Hello, everyone. Greetings of the day, everybody. I'm Priyanjali from Beautiful Spotless Skin Team. I'm sure all of you must be keeping good health. To look beautiful and smart at all the times is quest of humans right from the beginning of civilization. Few of the common conditions affecting the look and feel of a person is acne, hyper or hypopigmentation, and even hair loss. Out of these, acne is a big concern. Acne vulgaris is a chronic condition affecting more than 85% of adolescents and young adults. Yet, despite its prevalence, there are still widespread misconceptions and stigmas surrounding acne. That's why today's live we are addressing a common yet impactful issue that affects millions worldwide. Acne goes beyond skin deep, often affecting emotional well being and self esteem. Despite its prevalence, there are many myths and stigmas surrounding acne. Join us as we delve into acne management with our skin expert, aiming to debunk misconceptions, foster understanding, and empower you with effective solution for clear, healthy skin. Whether you are battling breakouts or simply curious, this session promises valuable insights and interactions. Today, we are honored to introduce Dr. Gaurav, a renowned skin expert from Pali. Dr. Gaurav Meghani is a highly qualified dermatologist with extensive academic achievements and clinical experience in this field. He completed his MBBS from Bharati Vidyapit University, Pune, Maharashtra, followed by MD and DNB in dermatology, venereology, and leprosy from Gitanjali Medical College and Hospital, Udaipur, Rajasthan, and National Board of Education, respectively. Dr. Meghani has served as a senior resident in prestigious institutes such as Jawaharlal Medical College and Hospital in Ajmer, and currently at Government Medical College in Pali, Rajasthan. His expertise spans the diagnosis and management of diverse skin disorders with proficiency in procedural dermatology, including biopsies, dermabrasion, and various excisions. Dr. Meghani also specializes in cosmetological procedures like chemical peels, laser treatments, and platelet rich plasma therapy for skin rejuvenation and hair restoration. Recognized for his contributions, he has received awards such as the third prize in paper presentation at the Rajasthan State Dermatology Conference and has publications in reputed journals. He is currently a private consultant at Dr. Meghani's Skincare Solution in Pali. Today, we are privileged to have him with us, and he will be sharing insights on acne and its management. We extend our heartfelt gratitude to you, Doctor, for joining us. Without further ado, over to you with the first question, which is what is acne and what are the types of acne lesion?
Yeah, acne is a pro-inflammatory process which affects mainly the pilosebaceous ducts and the units that are present mainly over the face, the upper chest, back, as well as the shoulders. It probably causes a lot of lesions, commonly called as comedones, which are referred to as blackheads and whiteheads by the layman, and papules, which are slight bumps on the skin, pustules, which are pus-filled lesion, as the name suggests, and this most severe form of acne being nodules and cysts.
Right. So, doctor, the main issue with any condition, any disease is identifying it. So, how does the initial stage look like? How does one know that now we need to visit a dermatologist? This can be acne and we need to get it resolved.
What you need to understand is acne starts as very small dots on your skin, if that's the right way people put it to me, because it looks like just whiteheads and blackheads, as I had mentioned. If not taken care at that very point of time, it tends to take a larger size, larger shapes, and which becomes a problem for the patient. So most of the times patients do come to us with such lesions in the first place. So if you are noticing any bumps on your face, back, chest, so this is the best time to go consult a dermatologist.
Right, right. So, doctor, does specific area of face acne means specific causes?
Mostly in, if we are talking about the teenage acne, which is more commonly it is referred to as like the mid face, the forehead, I would say almost the entire face is affected. But for patients who have adult acne, I mean adult patients who have to have acne problem, especially in females. They tend to have acne around their jawline, preferentially. So that is something we have to look out for in patients who come to us beyond 30 years of age, maybe.
Right, right. So, what can be the cause behind it?
A lot of causes can be behind it. As far as the teenage acne is concerned, it generally tends to start around the pubertal phase, when your body is going through a lot of hormonal changes, which tends to make your pilosebaceous glands, which are commonly known as the oil and the hair follicle glands. So they tend to be inflamed in that same very process. And as far as the adult acne is concerned, it is again has got to do with a lot of conditions, especially in females when they have PCOD or PCOS like symptoms. They tend to develop acne around their jawline pretty often.
Right. So, apart from these internal issues, are there any external issues which can also trigger acne?
Yes, there are many factors which can trigger acne. A lot of people these days apply a lot of things which they aren't aware of, and they tend to block the glands which are already blocked in the first place by the
Hmm.
inflammatory process. So there are very, very severe flares of acne if patients keep applying stuff which is less likely to work on them. So rather, it becomes a worse problem for them.
Right, right. Speaking about that, doctor, we see lot of products moving around the market right now. People are so much keen towards skincare because uh, everybody keeps saying that skincare is very much necessary, and we see what not they apply without any idea or any suggestion from the dermatologist. So, how safe can that be for people who are continuously applying it on a daily basis, morning and night? Uh, can that also have an adverse effect on the skin?
Yes, applying things which wouldn't work for your skin will always become a problem, like I said. Because if you apply something which has been already prescribed to you by a dermatologist, he might have examined you in that very sense so that you get something out of that very product. Most of the times, when people take products without a consultation, they tend to use products which aren't useful for them. They tend to make it worse. They most of the times use toners, bleaches, and whatnot. There are innumerable number of list for that very same problem. But yes, it tends to make it worse, and it becomes a challenging situation for us as well when they come to us after applying those products. So the treatment also takes longer.
Right, right. Now let's talk about the grades of acne. What are the grades of acne, doctor?
There are four grades of acne basically. The first one, like I said, mostly the patients is having only comedones, the blackheads and the whiteheads. The second grade is when the patients have a few comedones and a few papules. These are just skin colored bumps on your skin along with some blackheads. The third grade is when you have a lot of uh, papules as well as pustules. They look like yellow bumps on your skin. And the most dreadful and the most severe form of acne is a nodulocystic acne, when there are bumpy swellings on your face all together. And these swellings could be present anywhere, even on your back, chest, and the shoulders as well.
Right. So, the grades which we have just discussed, we normally see people, men and women equally, that whenever they see any changes or any pimple on the skin, they have a tendency of bursting it. So, can that be harmful or can that affect the skin somehow?
It is harmful, to be precise, because this is something that we try to explain to every patient that comes to us, that pricking or squeezing a pimple is gonna leave a scar behind or a mark behind, which is gonna be even worse than the pimple itself. So the one thing that
Right.
one should not do is squeeze or prick the pimples that they already have, or acne to be precise.
Right. Doctor, what about people with sensitive skin? How does acne look like in their skin, or how tough can be the treatment for it?
In people with sensitive skin, the treatment as well as the the appearance of pimples is entirely different, because they tend to have very fiercely red kind of lesions which even have a bigger impact on their social well-being as well. And as far as sensitive skin is concerned, the treatment options are very limited because not every product that we could have used would work for that very patient. So it has to be taken into consideration every time we come across a patient with sensitive skin.
Sorry for the technical glitch. We are back. So, yes, we are talking about people with sensitive skin, doctor. Can we please continue with that?
Yeah, in people with sensitive skin, the lesions of pimple look very different from what they would have looked in people with non-sensitive skin, if that's the right word for it, I believe. They look very fiery red kind of lesions, which have a very severe impact on their social well-being, like I said. And the treatment options are also very limited because not every product would work for them and would be safe for them as well.
Right. Right. Moving ahead, doctor, with the next question. What are the treatment options available for different grades of acne?
The treatment options are pretty different for every grade of acne that we are talking about. For the first grade that we had mentioned, just a couple of topical therapies every day, and the changes in their daily skincare routine would make wonders for them. In type 2 grade skin, we would probably think of adding a systemic antibiotic to the entire prescription, along with what we would have prescribed for the grade 1 patient. And in grade 3 and grade 4 patients, we have to go to topical as well as systemic retinoids, which have a very longer course of treatment as well. And that is how acne is taken care of. We have to make people understand that acne is not a contagious thing, if that's what you're asking. It is something which should be taken care of very seriously.
Right. So, doctor, moving ahead with the next question. What is maintenance therapy in acne?
By maintenance therapy, what we mean is when a patient comes to us, we tend to prescribing him or her medications which uh, make their pimples go away, kind of 90% reduction in their acne lesions. But when that happens, we have to make the patient understand that still you have to apply something and maintain a basic skincare routine so that you stay like that, because it is something which is gonna take a while for settling down entirely and permanently. Otherwise, you'll land up with
Right.
lesions which look very different.
Right. Doctor, because we are talking about skin here, we normally see people distancing themselves from any condition. If suppose if my the person sitting next to me, he or she is having a skin issue, normally we have a tendency of stepping a little aside from the person. So uh, is acne contagious? Is it possible that if somebody in your family is having acne and then you are using the same pillow covers or say the same towels, so can that also affect the other person? Is it possible?
No, 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 no. It won't affect the other person. It is just uh, using different linen or clothing would be better from a hygienic point of view. It is not a contagious thing, if that's what you're asking. It is not.
Right. Right. Also, let's talk about the food here, doctor. uh, how important is diet in when you're talking about skin here, when we are talking about acne here? What are the do's and don'ts one should normally maintain?
The do's and don'ts about acne should be, if you are having diet which is rich in very high glycemic index, you should try to take a step back from that. And if you are somebody who uses dairy protein in and out, that is something which should be reduced a little, because we don't suggest getting rid of it entirely, but taking one step back is always a good option. More importantly, only foods
Right.
with high glycemic index.
Any other food which one should, yes, any other food habits which one should normally avoid in order to get rid of acne, or the people who are already suffering from acne, any food which they should avoid?
Foods they should be avoiding are again the same things that I said: sweet products. If you are having something which is entirely dietary, dairy fiber based or dairy protein based, and it is always a good option to have antioxidants in your food. Green leafy vegetables would help, and they are rich in micronutrients, so they also tend to have a very beneficial role for people who have acne in the first place.
Right. Doctor, what about home remedies whenever we are talking about skin here? We belong from an Indian society. We love our home remedies, or Gharilu Nuske as we call it. So, any home remedies which work for acne? I've seen a lot of people applying fruits in their skin, and whatever they are eating, they are also making their skin eat it. So, can that be harmful, or can that trigger acne, or is it fine if they are doing all those besan and malai applying on the skin, or multani mitti is very much commonly used? Is that fine, or should we just believe the medicine and leave those gharilu nuske just to our stomach or the eating part?
I haven't come across a patient in my practice who has uh, seen wonders with the home remedies. But if you have to do something, stick to the basics. I would say nothing. Go don't go an extra step with whatever you are doing. But home remedies would be something which we don't suggest, because once you start
Right,
medications, the results that you achieve, they just cannot be achieved with any home remedies for that matter.
right. Uh, let's again talk about skincare here, doctor. There is after all of a sudden we are talking about sunscreen nowadays. How important is it to apply sunscreen? And for every possible skin, that is the thing which is very much important. We have never applied sunscreen when we are young, when we stepped out in the sun. I have never heard my mom asking me to apply sunscreen, please apply sunscreen. I have never done it in my entire life. Apart from now, I have religiously started following applying sunscreen, and I have definitely seen wonders. There is also a part of the society who believes that these are just marketing policies which the sunscreen companies, they are just applying, and it's also working for them. So what is the role of sunscreen in acne management, and is it really important to apply sunscreen for everybody?
I would say it is, you use the right word for it. One should be religiously applying it, and especially for patients with acne, because it is easier said than done that I ask my patient not to prick it. It is just human tendency. I can, even after my suggesting it not to prick it, you could reduce it a little. Nobody would stop taking it entirely. So once you are doing it, you are at a very high risk of having pigmentation on your skin after that. So if you are applying sunscreen, at least you are letting your skin deal with it, so that the pigmentation does not get darker and eventually it gets lighter by itself. So sunscreen for acne patients is an absolute must,
Right.
because a lot of treatment that we give is making their skin a little photosensitive as well. So if they are not applying sunscreen, it is gonna be a problem. So one should apply it.
Right. Right. Doctor, because we are talking about sunscreen here, another problem when we are talking about sunscreen is choosing the sunscreen. We do not know which sunscreen to choose, and we are just using the sunscreen which our friend is using or which our neighbor is using, and we have seen the person having somebody having a good skin, and then we all of a sudden ask, "Kya use kar rahe ho aap?" The same thing happened yesterday with me. I literally had a woman asking me कि ये दाग हटाने के लिए क्या करें and people are literally believing the other person also. Tell me how to choose the sunscreen, and which sunscreen would be perfect for the people who are residing in India specifically.
And people who are residing in India, I would
Residing
want
in
to
India.
advise to go for a sunscreen which is having an SPF factor at least more than 30. The point being, it protects you from more than 97% of the UV rays that are coming in, right? The other thing is, every sunscreen is not going to work for everybody. You have to choose what's right for you. Like we talked about, for people with sensitive skin, we'll have to give them something a uh, little with a little moisturization effect as well, right? For something with acne, we will have to go for something which is a gel based formulation, non comedogenic. Otherwise, applying sunscreen would make the patient land up with more acne that he or she had in the first place. So that becomes a problem. Sunscreens, we should be applying a good probable combination of both physical as well as chemical sunscreens, so that both the components of the sun damage that is being caused are taken care of.
Right. And doctor, what is the minimum SPF which somebody is which needs to be in one sunscreen?
Like I said, it should be more than SPF 30. 30 is good enough to take care of
Right.
the sun damage that we come across
Right.
every day.
Right. And how much to exactly apply for your skin? How much amount would be perfect?
I would say for just the face, you should apply at least 1.5 to 2 fingertip units. Uh, that would come across as somewhere close to 5 gram, 4 or 5 grams maybe, including the face and the neck, right?
Okay. Right. And for the people who are inside, mostly indoors. Uh, all the housewives, people are working from home nowadays. Also, a lot of influencers are in front of the screen all the time. So these people, they have an idea कि बाहर धूप में निकलेंगे तभी जरूरत है sunscreen का. So is it true? If what if we are staying indoors? Is it that much important to apply sunscreen even when we are indoors?
Yes, it is important to apply sunscreens even when somebody is indoors, because it is not just the direct sunlight we are talking about. We just cannot escape infrared or the UV rays that are coming in, and it is more important for people who are staying right in front of the screen all the time. So for them, a sunscreen with probably an IR filter is also very important. So it is a common myth, and we ask the patients to wear sunscreen even when it is cloudy, even when it is raining outside and you are still inside. You should still be applying sunscreen.
Right. Doctor, let's talk about makeup as well. For the people who needs to apply makeup and they are having acne issues, so which makeup to use? Is it okay if they use makeup? And we also see a lot of people not removing the makeup. Can it worsen the symptoms of acne?
Yes, it can worsen the symptoms of acne. It is advised, if you have to apply makeup, apply it for the least amount of possible time that you need it to be there. Don't keep it for longer than what is needed. And the other thing being, when we come across patients, especially of acne, when they ask us that we have to apply makeup, so we tell them apply a good sunscreen on your face. There are sunscreens in the market which can give you a foundation kind of effect these days. So that works both way for them. And if that is not even enough, apply sunscreen and let the take the makeup over that sunscreen rather than wiping it off entirely and doing the makeup on.
Right, right. Doctor, what about how hydration? We know when we're talking about skin, hydration is very much important. But does it has any direct relation with acne management?
Yes, hydration is very important, because this is also a common myth that we come across, that a lot of people come to us कि सर हमारी तो स्किन ऑयली है, हम मॉइस्चराइजर क्यों लगाएंगे. So the problem is you have a different moisturizer for acne patients. Not every moisturizer would work for them, but there are specific oil control moisturizers which are very very important, which tend to change the flora, the bacteria that are there in the acne lesions. They tend to rather be beneficial than bad for them. So it is a very important thing to maintain and hydrate their skin, because especially in severe acne patients, we are giving drugs which tend to uh, dehydrate the skin, if that's the right term. They see some dryness on their skin after taking medications. So then it becomes even more important than it would have been.
Right. Doctor, can stress also have an adverse effect on acne? Also, lifestyle changes for the people who are traveling a lot, they don't have a proper time to sleep. Uh, Pani regularly change ho raha hai. So, can these factors also somehow trigger acne?
Stress and lifestyle changes also seem to have a acne increasing property, because stress levels change the cortisol levels one is having in their bodies. So acne tends to flare after stress, as well as the treatment also tends to work less in patients who are very worried about their acne problems. So we have to make them understand that you need to uh, meditate a little, or we need to make them understand how this disease works.
Right. So, doctor, what would be the daily lifestyle changes or daily self-care tips that should be done to reduce acne?
Daily self-care tips: one would be keep washing your face regularly, at least a couple of times a day minimum. If you have acne, use right products for it, depending on what type of acne do you have. And one more thing, like we already talked about, is stop pricking or scraping it off the acne lesions. And healthy diet, working out a little, keeping your weight in check, all these things would help in acne, and achieve a better outcome along with the treatment or without the treatment as well.
Right. So, are we saying that obesity can also be another reason for acne?
Obesity cannot be another reason, but obesity generally tends to happen in patients, like I talked about, in adults with PCOD. So they tend to be obese. So obesity indirectly causes it because it releases a insulin like growth factor if it happens in children also. So it tends to aggravate acne, and that is how obesity could also have an effect, because it tends to make acne worse.
Right, right. Well, I can see some questions coming from the viewers, doctor. The first question, somebody asks, what are some everyday habits that can help with acne?
Like I said, it you need to wash your face regularly. You need to stop pricking your lesions, and a good moisturizer and a good sunscreen would go a long way in taking care of your acne as well.
Right, right. The next question, doctor, comes from Swati, who asks, what ingredients should I look for in acne fighting products?
That depends on what kind of acne you have, but in general, you can look for something with mild salicylic acid or mild retinoids, a good moisturizing, non-comedogenic products for the moisturizing capability of it, and a good sunscreen, like I said, SPF 30 with both the physical and chemical filters.
Right. The next question, doctor, comes from Arush Jha, who asks, how long does it typically take to see this improvement in acne with treatment?
That depends again on what type of acne, what grade of acne do you have. But in general, I would say once you start treatment, you would start to notice change in the coming 15 days itself. But that does not mean that that is when you have to stop. You have to have some maintenance therapy, like we already talked about. You have to, we will decrease the prescription frequency and everything, but still, some care needs to be taken care of.
Right. So, what is the normal rate of reoccurrence in acne? How often do we get to see it?
Reoccurrence is something that depends on what age you are presenting with acne, because we tend to see acne between 15 to 25 years of age pretty often. So once the course of the treatment is completed, and if especially talking about systemic steroids that we give for acne, the treatment should take somewhere close to 7 to 8 months, and then maintenance therapy that should take care of your acne for quite a long time.
Right. Doctor, can over the counter medications help acne, like for the people who normally have like antibiotics and paracetamols for like candies maybe, and for the women who have a regularity of consuming um, birth control pills, say. So, can those medications also trigger acne?
Yes, those medications tend to have pretty severe effect on their acne. And especially we come across such patients who are on oral contraceptive pills, especially adult females, of course, for that reason. They tend to have acne, especially in their jawline, and that is all related to the hormonal changes that the body is going through exogenously. They are doing it via tablets.
Right, right. Moving ahead, doctor, the next question comes from Rocky, who asks, how does it typically take the same question? How how typically it takes to see improvement in acne with treatment? How frequently
Like
that
I
is
said,
done?
it would take at least, you will see visible improvement in the next 15 days, but that's gonna be a while before it's taken care of.
Right. The next question, doctor, comes from Pooja, who asks, what should I do if I develop acne scars?
What should you do if you develop acne scars? So for acne scars, there are procedures that we do at our place. There's something called as fractional CO2, MNRF. That depends on what type of acne scars do you have, but there seems to be a very good improvement in acne scars. I would like to mention that getting rid of it entirely is not the right thing that I would commit, but yeah, fairly reasonable response is there if you have acne scars, but you'll have to go with procedures then.
Right. Uh, right. Doctor, anything else that we are missing that can make acne really worst? And what can be the worst case scenario of acne you have seen in your experience so far?
The worst case scenario that I would like to say is that this is also a common myth in at least the area of practice I am doing, because people tend to assume the fact that acne is something which is going to go away by itself, even if not taken care of. So then patients lead up with scars, both type. Like I mentioned, there are a lot of acne scars. To be specific, there are ice pick scars, box scars, and rolling scars, as well as hypertrophic scars. But once you have those scars, you cannot get rid of them entirely. You can see a 80%, 70% improvement in those scars after multiple sessions of procedures, but you cannot get rid of it. So the worst case scenario is you neglect it where it could have been way better for you, and in the stages where you come for treatment, we can give you a reasonable benefit there only.
Right. Doctor, speaking about neglecting, we know acne can normally appear in the upper portion or upper half of the body. So we normally tend to see that people avoid body acne. So can that also have some harmful effect, or is it just the appearance, just that people are, ashamed of wearing clothes like they want to? Apart from that, any adverse effect of it, and how do we manage it? Does it take more time than the facial area to get it healed or cured?
No, I would say it is actually better to treat, easier to treat truncal acne, if that is what you want to ask. And people should not be neglecting it as well, because there are medications which are easier to apply. Even if you're non-compliant with the treatment, a couple of misses here and there would not make the world of a difference. And even these days, we have come across body washes, which are technically not medications.
Right.
That is always needed to take care of that
Right.
part factor. So one should take care of that as well.
Hmm. Right. So can acne be cured completely? Is it possible for the people who are sitting and wondering कि completely तो कभी ठीक नहीं होने वाला है? So is it possible that it gets cured completely?
With treatment, yes, it is possible. I would come to this conclusion that even if you are not on treatment, you will see decreased number of lesions as your body matures and you reach a particular age. The only problem is
Hmm.
it will leave
Hmm.
its presence there, the scars, the pigmentation.
Right.
So it is treatable. That is the point, that you have to take treatment while you have a few lesions, or don't wait for it to become entirely scars and then we can give you only a decent amount of benefit.
Right, right. That's what we always say. Always suggest our viewers, our patients, that please get yourself treated in the initial age, because the treatment would be easier. It would be less expensive for you. जिस बारे में आप लोग हमेशा सोचते रहते हैं, it's always the money matter. तो it would definitely be less expensive. आपको तकलीफ भी कम होगा, harassment भी कम होगा. It will also take a lot of less time. So get it treated in the initial age, and by treated, I mean visit your nearest expert. Do not go to the chemist. Do not trust anyone's instincts or anyone's suggestions. The expert is somebody who can definitely give you the right solution to your problems. Doctor, we had a wonderful discussion on acne management today. Before we take a leave, any take home message for our viewers who has watched us so far?
Take home message would be, again, stop squeezing those acne that you have. Apply a good moisturizer. Always have your sunscreen handy with you and keep applying it. And take medications from a dermatologist in the sooner stages of the disease so that you have a clearer skin for the rest of your life, or a spotless skin, if that's the right
Right.
word for it for the today's session.
Yes. Yes. Well, thank you so much, Dr. Gaurav. That was Dr. Gaurav for us, and that was his expert advice. We once again thank you for your valuable time. It has been a very informative session for our viewers today, and it was great to hear from you. We look forward to many more such sessions in coming time. Also, thank you, viewers, for your excellent participation. For more information, stay connected to our page, Beautiful Spotless Skin. We are also available on YouTube, Twitter, and Facebook. Thank you. Stay safe and stay healthy.